one? Are you in this one? Well, you get brought up. I'm like, yeah, dude.
Needs to happen. I'm gonna get him to write that for you. I'm gonna get him to write that for us separately so it's enough.
His favorite kids. I want to take a note.
Was it good?
Yeah.
Focused enough? I had to rush because we were full.
Actually, one of your slides, I want to summarize it.
I got my little piece of paper. So where do you guys get those figures from? Because I know we spent more than over $1 million in 2012, from 11 to 2016.
So we
on the
missed-
Gulf oil spill.
But so we missed a bunch, and I admit
Maybe
it.
you can't see your intramural stuff.
It's because we missed like some of the late perk money that came out, but we just did a search on it.
No, I think it's cool. I mean,
and that's why at the end I
the
said,
general-
what difference
the
does it make
general
if it's
gist-
10 times less?
Yeah,
or
the
20?
general gist
Right.
is exactly right. But I'm just kind of thinking about, well, what are we spending in that space?
But then again, so part of it was we didn't consider the search for environmental money, and we focused on health and public health, so it may have fallen out. We had to cut our current down in research and so we left environmental research from.
If you could just tell them instead of we have two standard mics, so people should just get to speak rather than.
If they want a question, go to the mic. Okay. Okay, everybody, let's reassemble. I have some announcements.
Yeah.
So thank you very much. Good morning to start with. For questions going forward, to make it a lot easier and a little more equitable on people, if people are interested in asking questions, if you could move to the mics, that would be useful, I think. This next session, we're going to turn towards away from the response and away from the needs, and we're going to talk about the kind of the federal perspective from a number of different organizations regarding disaster science, the current state, and et cetera. And I'm not going to introduce the panel. I'll leave that up to Dr. David Applegate, who is the current head of the Subcommittee for Disaster Reduction and has been leading efforts at the federal level for quite a while. So, thanks, Dr. Applegate.
All right, thank you. Well, thank you very much, and really appreciate the opportunity to participate in the workshop, and hats off to Tom for the invitation, and I want to also acknowledge Tom and Lori Peak for their efforts to bring together the disaster research centers. I think this is tremendous. Building this alliance is a great step, building the connectivity that is so important here. We had a great kickoff from Craig Fugate, and I'll say that in the spirit of getting out of our org charts, which was one of the commandments, one of the things that, as Tom mentioned, I chair an interagency subcommittee on disaster reduction that is set up to support the White House Office of Science Technology Policy. It brings together both the science producing agencies as well as those that are the science consumers. And a lot of the value in it is simply building that connective tissue, building those set of conversations, shared understanding, so that we're not trying to do that and scramble in the disaster setting. And one of the things that has been really tremendous in recent years is that we've seen increased participation and engagement from the health sector, having NIH involved, having CDC, the Public Health Services, now with USU as well, and it's just been tremendous because, as has been pointed out, that's a very key part of all of this. So have greatly benefited. We're going to hear a great set of perspectives from my federal colleagues on federal disaster research activities. But before I turn over the mic, I did want to just say a few words about my own agency, the U.S. Geological Survey, and our really increasing engagement with the health sector, and which has been tremendous for us in terms of benefiting our ability, leveraging our capabilities with a new suite of partners. And I want to acknowledge my colleague Jeff Plumley is here. He's our Associate Director for Environmental Health at the USGS, and he's really been our key ambassador to this community. You know, we at the USGS, we work on a wide range of hazards. We've got direct responsibilities associated with geologic hazards, earthquakes, volcanoes, landslides, but for a lot of others, we're the eyes and ears for our good friends at NOAA, whether it's stream gauge networks or seismic networks that feed into tsunami warnings, or worrying about things like space weather and geomagnetic storms, or worrying about outbreaks in wildlife and the potential to cross over and become zoonotic diseases. So quite a range of these. And in all of these hazards, we work from a foundation of monitoring capabilities and matching that with expertise to be able to bring to bear, to be able to look at in terms of long-term assessments, as well as providing real-time situational awareness. And one of the key realizations for us, you know, we want to see our science to be used, and often that means moving out of that realm of hazards, whatever the individual hazard is. You have to make it real to people. You need to be working in the sphere of what are the vulnerabilities, what are those impacts. So really making that handoff from hazards to risk is critically important for us, in an area where we're increasingly engaged. And one of those aspects of risk is the arena of health impacts. And so our role within the environmental health arena is, you know, understanding those environmental contaminants and pathogens, the hazards that they may pose to the health of humans as well as other organisms. And this was very much demonstrated during our response to the Kilauea eruption, which was a big deal for us this past year, months of an extended response period. And of course, there was quite a range of health-related aspects associated with that, whether from the volcanic ash particles and you know, which may contain fluoride and other metals, sulfur dioxide gas, exotic things like volcanic fog or VOG, or LAYS, which is you know, glass particles being blown through the air, which don't do well with lung tissue. And in all of this, we had very good collaboration with EPA, the State Department of Health, National Park Service, and others on air quality monitoring, providing ash dispersion models and water quality monitoring. We hosted multi-agency health-focused community meetings and had a strong both web and social media presence for pulling together all of these different data streams and information coming out on the different aspects of the hazard and of the disaster. We want our information to be used, but for that to happen, that's not going to happen naturally in the event of the disaster. That means we've got to be engaged very much with the users early on in the process. One of the most powerful tools that we've found for that engagement are doing scenarios. And to Craig's point, scenarios of truly catastrophic events, and not, you know, we can provide that foundation of what the hazard is, what maybe the cascading consequences, the multiple hazards that are going to be faced in that event. But it's only through engagement with a wide range of partners in terms of the engineering community, the public health community, the planning community, that we can really look at all of that range of impacts to be able to be wrong, right? The whole idea of a scenario is to be wrong, is to be able to say, this is what would happen under current conditions, and now we can get to work figuring out how do we change those outcomes. Just as Craig said, to use an exercise to see what breaks so that we can see that in the real event it's not going to do so. So we've done that for a number of hazards. Most recently, this last year, we did one for the Hayward earthquake in the Bay Area, looking at, this is you know, probably the most urbanized earthquake disaster that we're going to confront as a nation. And of course, as part of that is a wide range of environmental contamination concerns, challenging health outcomes associated with these different cascading hazards. And so that has been a basis. We've now sort of handed that off to the state and local governments to create what they've called the Outsmart Disaster Campaign and figure out how they can use this to build the conversations and build the actions that can then make it wrong. So again, this has been, for us, this is a really important, it's a real opportunity to be involved in this, and look forward to the discussions. So with that, I'm going to turn it over now to, we have a number of different federal agencies that play key roles in this sort of disaster research enterprise and the application thereof. And I'm going to begin with, with my distinguished colleague at the National Institute of Standards and Technology, whose ears have been burning through the whole discussion about an NTSB for disasters, because I think that what NIST does is probably the closest that we get, looking at a number of different aspects associated with that. So she is the Director of Disaster and Failure Studies program at NIST. Should be this. Success studies, is there such a thing, right? So with that, I'm going to turn it over to her, so thank you.
Thank you, David, for that warm welcome, and thank you, Tom, for the invitation. So it's truly my pleasure to be with you all this morning and explain to you a bit about what we do in terms of disaster research at NIST. So I don't think a lot of you are very familiar with the disaster research program at NIST, and it's actually quite broad. So I am really excited to be here today. So for those of you that don't know NIST, it's the National Institute of Standards and Technology, and it's a measurement science agency. And it houses a diverse set of laboratories ranging from providing the official time for the U.S. to defining best practices for disaster metrology, so the science of measurement, right, for disasters, to helping protect American lives. A significant portion of disaster science at NIST is carried out by multidisciplinary staff in the engineering laboratory, which is where I reside. And this staff includes structural engineers, chemists, physicists, social scientists, meteorologists, systems engineers, and so many more. And that's like my big plug for NIST, and now I kind of just talk more freely. I have to have my official language, right? But so NIST is actually really uniquely positioned because we have so many different kinds of scientists and engineers in-house to do so much research. And we also have so many extramural programs so that we can collaborate with other federal agencies, with academicians, and so many others. And so one way to think about what our capabilities are at NIST in terms of measurement science is that we can go from the micro level, from like the material science, very deep physics and chemistry of the materials that we're using to build our infrastructure, all the way to the regional level. Also hitting kind of that macro level, which is the structures. So we have a structural engineering group, we have an earthquake engineering group that mostly focuses on structures, we have a fire research division, we have a wind engineering group. We do a lot of work at that macro level, at that micro level, and then most recently at the regional level. So for those of you that don't know, a couple of years ago, NIST put out a community resilience planning guide. And this was really the first like it in a federal agency. There's been a lot of research and a lot of work done on disaster or resilience in general, but the federal agency had not cohesively taken a position on how we should go about addressing resilience and becoming more resilient to disasters. So this community resilience planning guide, which is put together by a very diverse group of people over many years, is really kind of unique to what we generally do at NIST, right? Because it's a bit more in terms of outreach and education than it was for doing science in-house. Anyway, so that being said, we kind of cross all of these scales, which means that we can study all kinds of very different and exciting things and do so by just walking down the hall or going downstairs and talking to our colleagues. So that's all of our kind of in-house operations for disaster science or research that we're capable of doing. In addition to that, the program that I run, the Disaster and Failure Studies program, came to be because of the 9/11 attacks. So after the World Trade Center towers collapsed, the federal government realized that there wasn't an NTSB for buildings. And so who's going to investigate what was the technical reason for why the towers fell? And could we have done something better to have, kept them up longer, saved more lives, helped people evacuate from the buildings? But there wasn't an entity within the federal government that was authorized. And that's a very important word that I've learned. Now, I used to be an academic and now I'm a federal agent. You're authorized to do this kind of work. And there really was no one within the federal government authorized to do this kind of work. So very quickly, the National Construction Safety Team Act was passed. And so NIST was given the responsibility of running this very important program, which is the equivalent of NTSB, right? So NTSB investigates airplane failures and other transportation failures. We investigate building failures. However, under that authority, we have a little bit of wiggle room because we're meant to investigate why buildings fail and or why they perform very well. We're also meant to investigate why buildings kill people and or potentially have exposed people to loss of life. And that is actually also very important because it puts us into the health space without NIST naturally living in that health space. And I say that because it's very unique and very different to anything that we do at NIST. And then the third piece is on the emergency communication side. So what kind of communications were used during the emergency to help people evacuate from structures? And again, if you read the law, it's a knee-jerk reaction to what happened in 9/11, but it wasn't, it's understanding that there were egress issues, understanding that, there was obviously building failure issues, but it wasn't looking more holistically at what we could do, right, with the National Construction Safety Team Act. And so if you know me, I like to push the envelope. And so under this NCST, we've done many investigations, the first being the World Trade Center, the second being the Rhode Island nightclub fire, and then Joplin. And that was the last one until recently we just started the Hurricane Maria investigation in Puerto Rico. And so under that, we're running an NCST investigation that's looking at better characterizing the wind hazard and loads on buildings, looking at the performance of structures and especially focus on engineered structures because we're meant to provide science to hopefully change standards, codes, and practice. And so we needed to start with engineered buildings so that we have a good initial condition and a good understanding of what the initial conditions are for those structures. And engineered structures allow us to do that. We can at least go back and see what building code were they designed to and did they perform the way we expected them to based on their design, right? And in addition to that, we have an emergency communications project in the investigation, and we're also looking at the mortality and how buildings and the failure of our infrastructure and our building systems may have potentially killed people in Puerto Rico. So that's part of the NCSC investigation. However, NIST also houses two very large hazard programs that are interagency programs. The first of which is more than 40 years old, and I know David's very familiar with it, but it's the National Earthquake Hazard Reduction Program. And this is a very important program. It's an interagency program that includes USGS, it includes FEMA, it includes NSF, and includes us, and it's headquartered at NIST. The second program like it is the National Windstorm Impact Reduction Program, which is a much younger program, but has the same intended purpose of trying to reduce risk to the American public by these types of hazards and loads. Now, NWIRP, which is the National Windstorm Impact Reduction Program, instead of USGS, swap and put NOAA in place, and that's our interagency program. However, it does also, both programs authorize us to do research in disasters. And again, I use that word authorize because it's very important. So it means that we're able to do more with our investigation. We have this ongoing NCSC investigation, which is really important. But while we're looking at the performance of engineered buildings like hospitals in Puerto Rico, we could be using our NWIRP authority to look at the recovery of the healthcare system. And that's really powerful, right? So we are not authorized to do that under NCST, but we have these other statutory programs that allow us to leverage the work that we're doing in Puerto Rico. And so our NWIRP projects are focused on the recovery and the resilience of the supply chain in Puerto Rico, businesses in Puerto Rico, looking at healthcare and education systems in Puerto Rico and the infrastructure. And those are distributed lifelines, so power networks, water networks, which are not authorized specifically to do under NCST. All right, so those are all the really exciting programs that I run at NIST, and I love it. But I should also add that we have an extramural program, and so we have a very large center of excellence that's focused on community resilience. That center of excellence is headquartered at Colorado State University, and so we're able to do a lot of research in collaboration with them and do things that we wouldn't normally do. So we have over 50 years of investigating and doing research on disasters, and we have always looked at the impact of the disaster. Hardly ever has NIST looked at the recovery from that disaster. So being able to partner with our Center of Excellence, we're able to do things like longitudinal studies. Lori's involved with one that we're working on right now in Lumberton, North Carolina, when we're looking at household dislocation, not just immediately after the event, but returning year after year and having a commitment, right, to go back to these communities that a 3-year NSF award wouldn't allow us to do. But having a large disaster research program and an accompanying Center of Excellence does allow us to make a commitment to return to a community and really understand what are the hurdles in recovery. So in addition to that, we do have an extramural disasters resilience initiative grants program, and we put out grants every 2 years to academics. So please take a look at that if that is who you are in the room. And I think I reached my time, but thank you so much.
All right, thank you. So next up, we have Aubrey Miller. He is the Senior Medical Advisor at the National Institute of Environmental Health Sciences. Having recently retired from the U.S. Public Health Service, I'm still not used to seeing him in mufti, but I'm starting to get a little more used to it. So anyway, Aubrey.
I think I've gotten taller since I've retired. So I'm going to talk about this in a second, too. So I'm at NIH, National Institute of Environmental Health Sciences, where we focus on environmental health risks associated with human populations and reducing those. But I started really in this trajectory, and I just want to say I'm really excited to be here. This has been something I've been passionate about for a long time. I started into this space in 1997 with floods in Cincinnati, Ohio, when I was at CDC and NIOSH, and I just went out driving around trying to figure out worker health issues associated with the disaster, and started asking questions. Well, why don't we get this information? You know, these workers are doing this, and how come the DMAT teams that are there aren't collecting information about these workers and cataloging it? And Craig Fugate talked a little bit today about mortality. Well, why don't we understand morbidity, and why don't we understand those risk factors? And here we are, that was 97, so we're 22 years later, and we're still kind of in the same space. So what we're talking about here is what you guys all do, is get data and information, but how do we do it together and do it fast and on steroids in a new way? And I love that everybody's here thinking about this, because this is something that we need to figure out ways to do it better, because the system isn't built for this, right? So that's what we've been kind of struggling with. Our system is not built for this. So I've had experiences with EPA, Department of Health and Human Services, also with the Food and Drug Administration, as I said, CDC, and now I'm at NIH. So I kind of look at it from different agencies and different cultures, and what we kind of contribute. And you know, Judy just talked about NIST, but how do we think about this important information? We're talking about a spectrum of information to make it usable, applied, together, and fast. Right? So lower the bars. Let's think about what we do and how to bring it together in ways that are more creative. I was actually working on the H1N1 situation with FDA, and you know, had some experience with thinking about how do we get drugs to people quickly, and then said, you know, kind of enough of disasters. I've been doing this for a lot of years. I went over to NIH figuring I was done with disasters. I can just kind of relax. NIH doesn't do that kind of thing. And I was there 2 weeks, and the Gulf oil spill hits. And we have this scream round, like watching it on the TV and going, wow, I'm glad we don't have anything to do with that. And next thing I know, I'm down there, you know, working on the Gulf and back at it. And as I said, I was at U.S. Public Health Service, so I've had different kinds of opportunities to look at these things. But we started working on the oil spill. At the same time, we were working with the department and thinking about how do we advance this? There was discussion about the NBSB report, the National Science Biodefense Safety Board, and other things that, we keep talking about it. How do we make it better? Our experience trying to do the Gulf oil spill studies based off of the backs of CDC and NIOSH setting us up and others, thinking this through is, let's get at the process. There was that paper in the New England Journal, came out in 2013, and it kind of broke it down in different areas. And one major area that we start with is, what should we study? What are the gaps that we need to understand from each of our perspectives, from a healthcare perspective, from an environmental perspective, from a NIST and structural engineering perspective, but we don't have that conversation together. So we're all doing this in our individual silos, but we're not bringing it together. So that platform hasn't existed. It's usually, I know somebody, I'll call David over at USGS and say, hey, David, what are you guys doing? That's not a great system, because if David retires, I don't know who to call. But, and we're all getting older, so, that too. So that's, not exactly the answer, but we're doing this. The other pieces of it are how do we use our partnerships in more creative ways? CDC has partnerships with public health. We have partnerships with our academic community, and some of them are here, which is great to see. And how do we use those partnerships more effectively and bring them together when a crisis happens? So we decided, we thought we would take this pilot project. The paper that was written in the New England Journal was led by Francis Collins, who's the director of NIH, and this former CDC director, Tom Frieden, and Nikki Lurie, the former Assistant Secretary for Preparedness and Response. And they basically, threw out a gauntlet of some areas, which were followed up by the National Academies meeting at NIH in 2014. But we talked about a lot of the things we'll be talking about today, which is, how do we move this along? So we thought we would start a program to see if we could make some headspace, at least in the environmental health realm from where I'm sitting. So we thought okay, let's see if we can't just get the data collection tools that people use in one place. So that way, when we have another Katrina, and we're focusing on the mold and health effects, which I've been doing since '97, and then all of a sudden we go, well, where are those tools? And how come they're not available? And if they are available, people keep recreating new ones, so we don't have any standardized metrics. We don't collect things in a way that we can do any comparative data analysis. So at least let's start trying to do that. So we began to do that. So we created a space where we had created a repository for tools for researchers that cover a gamut from environmental health to social and behavioral sciences and mental health. So we've been trying to at least pull that together, create faster processes. We basically went to our IRB and said, hey, we want to create a protocol for research for human health, but we wanted you to approve it, essentially, or pre-approve it before a disaster happens, which is, they first that shriek of, whoa, IRBs don't do that. So we sat there with them for about a year, and they actually did it. And our grantees, our centers, have taken that and have created their own, and I'll give you an example in a few minutes with respect to that. So networks of researchers, training and integration, and we talked a little bit about scenario play, and that's been really useful to us in terms of thinking. First off, our director asked, is this useful to the community, to our partners, our academic stakeholders? And we went out to California and had a scenario, and we basically did something like the oil spill, but instead we'd used actually a scenario based from USGS and did a tsunami kind of scenario. And we came back and from the California State Health Department said, yeah, go for it. That's a really important thing. We like what you guys are doing, trying to improve our ability to get science. So let's go to the next slide. I guess I have it, right? Okay, I got it. All right, so we work with the National Library of Medicine in this, and this is our website. We've just been collecting 350 plus tools in different areas, and I have little cards for this. I can give you guys little cards later. But anyways, you can just do NIH DR2 on Google, and you can find it. So that's easy enough. And anyways, it's a website that we've been trying to work in this space. So we have things about IRB and things about protocols and tools and all of that. Here's our protocol that we developed called RAPID. And FDA has a RAPID thing too, so not to be confused, everybody likes the name RAPID. But we created a protocol that's a generic protocol, essentially says, hey, when something happens, we're going to go down the menu and say, we want to do respiratory, we want to do mental health, and we want to do maybe dermatological and neurological. And here's the components we're going to use. And we turn around and give it to our IRB, who has promised to give it back to us within 24, 48 hours, which sounds amazing. We haven't tested it in reality, but fortunately, our grantees and stakeholders and research centers have. I'll give you a quick one, and I don't know if Umar's still here. I saw him earlier this morning sitting over there, but Umar Shah from Harris County Health Department in Texas. So actually, we ran a scenario, going back to the scenario in Houston in 2015, essentially the same scenario that happened in 2017 with Hurricane Harvey. But our scenario was we brought together academics and community and public health, emergency management, environmental folks, and sat around a table and talked about how would we get data together, including our academic partners, in a way that would be helpful if a situation was to happen. It was a one-day workshop. David, I think you were there. One-day workshop, and basically saying, could this work? And, have those conversations and try to see if we could build some connective tissue between these groups. And we went back, and lo and behold, we actually were doing a survey in 2017, early in the year, per my director said, whatever happened with those workshops we ran, and were people still doing things? Well, lo and behold, they were, and some of our partners had actually created those protocols that I talked about, the RAPID, but they had their own. So at the university level, IRB pre-approved protocols. And when Hurricane Harvey hit, this is kind of what happened, is they sprung into action really quick. And this wasn't based on federal funding, because we were slow to the game, and we'll talk more about funding this afternoon. But they were able to actually work together using pre-approved protocols with public health, with communities that had been there before, and actually started getting into the field and collecting good science in the environmental health realm together. So here you had different collaborations. You had environmental testing for floodwaters and sediments and health studies, and going back to community neighborhoods and leveraging those partnerships. I mean, Craig Fugate talked about how do we get those partnerships. We work off partnerships that exist, and leveraging those pre-existing partnerships with communities that we've done studies with, communities that all of you are working with in your different realms, pulling those together and working with them in a creative way. And this was really cool. So this was a nice action model. All right. Last slide. I guess I'm getting the time out. So University of Arizona workshop we just did, which was a train derailment incident on chemicals. And I guess I won't talk too much deeply, but this was one that we tried to integrate between clinical health, research, clinical medicine, and treatment of patients that would be exposed to a chemical disaster in Tucson. It was essentially locally led and essentially owned by University of Arizona, Pima County Health, public health departments, along with us and others trying to empower this discussion between integration between population studies and health studies, and getting information. And the cool thing was a lot of the students in the schools of public health and pharmacology and other groups helped lead it, and they were engaged with the health departments about how do we collect information, how do we work with the communities, and how do we leverage that. So I'll be happy to talk to more of you offline a little bit about that, and thank you for this opportunity. Thank you.
Thank you very much, Aubrey. All right, next up we have the Director of Disaster Science at the Health and Human Services, ASPR, which is the Assistant Secretary for Preparedness and Response, Laramie Kulf.
I always like talking after Aubrey and Judy. It makes me feel really tall. I could be 5'5" and it'd still make me feel tall, but whatever. It is my pleasure to be a part of this group. These are absolutely wonderful people who are doing great things, and I just feel lucky to be a part of it, and I'm glad to be here with all of you today. So Tom told us that this is a very varied group, and not all of you might know the weirdness that is government. and who we are and where we fit. And so I also have my little bit of stock language at the beginning that is approved as of congressional testimony, so everyone can hear it and it's correct, right? So ASPR, the Assistant Secretary for Preparedness and Response, our mission is to save lives and protect Americans from 21st century health security threats. On behalf of the Secretary of Health and Human Services, ASPR leads public health and medical preparedness for, response to, and recovery from disasters and public health emergencies in accordance with the National Response Framework, Emergency Support Function number 8, which is Public Health and Medical Services, as well as the National Disaster Recovery Framework, in which we lead the Health and Social Services Recovery Support Function. ASPR also supports HHS's role in delivery of mass care and human services in emergencies, and that's Emergency Support Function number 6, if you guys care about those types of things. When ASPR was established by Congress a decade ago in the Pandemic and All Hazards Preparedness Act, the law's objective was to create unity of command by consolidating federal non-military public health and medical preparedness and response functions under the ASPR. The impetus for this was the disorganized and fragmented response to Hurricane Katrina in 2005. ASPR coordinates across HHS and the federal interagency to support state, local, territorial, and tribal health partners in preparing for, responding to, and recovering from emergencies and disasters. We work with groups across the government to help enhance the U.S. medical surge capacity by organizing, training, equipping, and deploying public health and medical personnel, such as the National Disaster Medical System teams, and providing logistical support. We also support a lot of state and local initiatives, responses. We coordinate federal grants and cooperative agreements, like those in the Hospital Preparedness Program and the Medical Reserve Corps. And we also carry out drills and operational exercises. So ASPR also oversees advanced research, development, and procurement of medical countermeasures, vaccines, medicines, diagnostics, and other necessary medical supplies, and coordinates the stockpiling of such countermeasures. As such, ASPR manages the Biomedical Advanced Research and Development Authority, or as Tom says, that BARDA thing that I can't ever remember what it's called, Project BioShield, and the Public Health Emergency Medical Countermeasures Enterprise. So that's the end of my stock speech, and now I also get to say whatever I want. So the way what I do came about is, we deploy to all these responses. We end up in the field. Everybody's running around like crazy because it's emergency management. And it was Deepwater Horizon when our assistant secretary went down there, and she kept asking all these science questions. So what are the health effects of all of this oil? And they're like, oh, here's our material safety data sheets. This is what happens when it gets on your hands. She's like, that's great, but this is spread out over the Gulf. It's really hot here. The sun's shining. Everything's getting vaporized, and we're breathing it in. What are the inhalation consequences? What about the stuff we're using to clean it up? They're like, oh, here's the material safety data sheet on that. She's like, same thing, vaporization, aerosolization. How much protective equipment do people need to wear? How long are they safe being out here? It causes oil to clump. If it's falling down on the ocean floor, what's that doing to sea life? Is it safe? How long does it remain down under the water? What's it doing when it's mixing with the runoff chemicals that they were using to get rid of screwworms in the cows in Texas? And the answer to all of these was, I don't know, I don't know, I don't know. She said, our response and our policies would be so much better if we knew the answers to these questions. We really need to figure out the answers to these questions. As soon as this response calms down, we're going to do that. But it went from one response to the next, to the next, to the next. We ended up back in another oil spill, and we still had all of the same questions and no answers. So that's what they created my position for, which I didn't really get when they said, hey, come over and work with us. You're in charge of everything in a response. But it's also actually ended up being really, really fun. And so I do some stuff with short-term response issues, some long-term projects, and then a lot of work working with the real researchers like you guys to implement the great work that you're doing as the implementation partners in improving our policy and in improving our operations. So I'll just give you a few examples of some of the things that we have done and are doing. The short-term response issues, so we have the Secretary's Operations Center in downtown DC right by the Capitol. And it's your typical Emergency Management Center, there's a whole bunch of computer screens, a whole bunch of tired, sweaty, cranky people who don't smell very good and eat too many donuts. Because that's all they bring, and you never go home and sleep. And during Hurricane Harvey, I got so fat that I couldn't fit into any of my suits. And being a government worker, I didn't get paid well enough to buy new suits. So I just had to go on a diet. But everything that happened when there was some random out of the blue question, it was, hey, Laramie, this sounds like science or technology. You've got 4 hours to figure it out, and then we're doing deployment. Really, really fun. Some things like, we need to figure out where all of the flood levels are in real time in Houston, which floods everywhere. We can't dedicate any people to it, and it needs to be some remote sensing technology. Figure it out, you've got until tomorrow. And that's when the coordination and the friends and the network comes into play. USGS not only has access to a pair of satellites that uses remote sensing cloud penetrating radar, but they also have international agreements that activate in disasters that get us access to the same types of pairs of satellites in Japan and the European Union. Then with our academic partners in Colorado, I called Lori Peek and I said, Lori, I need some help. Do you know smart people? She's like, actually, I know these wonderful people just down the road. Let me put you in contact with them, that would do all of the analysis and use the reference baseline images and give us shape files that we could upload into our Esri maps that say, here are the exact levels of the floods. Here's where they are in a map to within 10-meter accuracy. And then being the good investigative researcher using accurate sources that I am, I found some articles in the Washington Post that they got access to street cameras and security cameras all over Houston with recent or live feeds, and you could pull the pictures from them. And I used their mapping and references to tie them back to my real-time map with all the flood levels so that you could see actual pictures of what was going on. So I taught her over to the response people, and I'm like, hi, is this helpful? And they're like, yes, this is helpful, thank you. What else can you do? And I'm like, I don't know, what do you need? We did things in Florence because there was going to be so much flooding. They said, okay, we need to get all our supplies down now before it floods. We need to know how many people are going to be in the shelters and how many people in shelters request flu vaccines so we know how many to send down. So I went and read the scientific literature. Umair published this great study on the numbers of people going into shelters in Hurricane Harvey, how many of them had medical needs and issues, and how many of them wanted flu vaccine. 10.85% turns out. So we did 11% of the projections from our partners at the Red Cross of how many people were going to be in shelters and got down the right number of vaccines. We did things on suicides and disasters. And then sort of the big one ongoing, since I have a minute and a half left, is we're building a database in partnership with the Agency for Healthcare Research and Quality and the Assistant Secretary for Planning and Evaluation and Aubrey's group, that we got access to de-identified, this is another one of those really important words, de-identified patient data for every patient in every hospital in 47 states from 2000 until present, and emergency department data in 36 states. So that when we're combining that with Waze traffic utilization data, historical and current, Red Cross shelter data, the medical care that they're receiving in Red Cross shelters, and hospital operating status and pharmacy status, things with Healthcare Ready. We're combining all of those together so that when there is a disaster coming, right before it happens, or in a no-notice event right when it happens, we can get a representative example in the same place of the same type and know exactly what the healthcare needs were then, apply it to our most recent baseline, and right-size our operational responses, support our hospitals and healthcare systems, and support researchers by providing all of this historical evidence so that you can look at the effectiveness of interventions. What's the difference in evacuation messaging in Texas, in North Carolina, and Florida? What's most effective and what leads to saving lives? When did this new emergency management technique get introduced, and how can we use actual trials to compare the differences between the two? So I am out of time. I'm going to stop babbling at you. It's really nice to meet you all. I'm excited to be working with you, and go team.
So I don't need to tell you that FEMA is a very key conduit for applying what we know and being able to change outcomes. We're very fortunate to have with us Christy Collins, who is the Operations Branch Chief for Individual and Community Preparedness at FEMA. Take it away.
Thanks for having me. I usually, when I'm speaking on behalf of FEMA, have to very sternly remind people that I work for the unsexy side of FEMA because I just work in preparedness. I don't do fancy things like paper towels and urban search and rescue. So it's really nice to be with a group of people that actually might agree that preparedness is the sexy part of disasters. So that's really fun. So thanks for having me here. My background is actually in urban planning and community development. And then moving through that, I've started to study or have completed studies in communication. And so I really focus on the intersection between what makes a strong community and how do government organizations communicate with residents to help them make their community even stronger. So I came to FEMA about 3 years ago and have really focused on how we can communicate as government or as partners with the government in these different disaster opportunities to help individuals make their own communities more resilient. And to me, that becomes the very sexy part. So we look at what happens in disasters and then figure out what could we or should we have done prior to that to make communities stronger so that they can survive or recover faster or in a more improved way or reduce loss of life or loss of property. And so that's really at individual and community preparedness where we focus. As far as the research that we do, we have 3 different areas that I wanted to share with you guys. So first, as we look at protective actions. So my favorite thing, usually in a public setting, is to ask people to think, in an earthquake, what do you do? And usually about 40% of people will say, oh, you get in that door frame. Because it's just like such a bizarre thing that they taught us 20 years ago. Like, why would you get in a door frame? And it turns out, please don't get in a door frame. That's not what you're supposed to do. What you're supposed to do is drop, cover under the table, and hold on until the shaking stops. I'll probably retire and people still will be getting in that door frame, but if you remember nothing else, don't get in a door frame, please. That's not what you're supposed to do. And so we look at protective actions for all sorts of different hazards and try to figure out, okay, what is the simplest thing that individuals can do to remain safe? So of course, there is the earthquake example. We have a team of people and we partner with folks like you to look at things like, okay, if you're outside during a tornado, what do you do? If you're driving a Hummer, what do you do? If you're driving a Fiat, what do you do? If you're in a cornfield, what do you do? All those things have different answers. And there's no simple way for me to tell you what that is. So our simple answer is get inside. But if you're in the middle of a cornfield and you walked there, you can't get inside. So how do we communicate all those complexities to someone in a way that they remember it when they are not thinking about tornadoes at all? So those are really the complex things that we try to look at. As we've kind of gone through and expanded our portfolio of the different hazards that we look at, there are things like nuclear event, which gets even more complicated. I've seen these crazy maps, right, where it's like, okay, if you can get to this location within 10 minutes, that's safer than staying where you are. And I've kind of run this scenario even for myself. And it's like, who knows, but probably go to Target because they will have toilet paper for a long time. And so that's like, that's what you have to kind of think through. But how do you get individuals to think about that? Because that's scary. No one wants to think about what am I actually going to do if that happens. And so we have to kind of look at creative ways to communicate that with people in a very, very simple way. So this is actually the results from a national household survey that we do. We started it in 2013 to really look at how do individuals look at preparedness and what are they doing, how do they feel about it, and how can we move them through the stages of change. And one of the things that we've learned is over the past 5 years, we've actually gotten to a point where 92% of the respondents are saying that they've taken one action, which is, when someone asks me then improve on that, I'm not going to get those last 8% to ever do anything, right? So now we're starting to look at how do we get those people to start taking even more actions and be aware of the different things that they're doing. So in looking at that, we've really looked at what are the things that influence preparedness. And to keep it very simple, it's always interesting to me that there are kind of obvious things like being aware of the hazard or having experience with a disaster. One of my favorite stories is that someone felt she had been through a disaster and she felt more prepared now because she knew if she has to evacuate, grab the dirty laundry hamper because it's seasonally appropriate, size appropriate for her kids, so that's part of her plan. Also knowing that preparing can help you to be successful in surviving a disaster. But what doesn't work is understanding what the risk is. So those are the types of things that we try to focus on. And then we have programs such as the Community Emergency Response Team or youth programs or Until Help Arrives, which is kind of a spin-off of Stop the Bleed. And those things help individuals to prepare as well. So we have a pretty robust portfolio, which I think is the very sexy part of FEMA, but doesn't necessarily reflect in a lot of the news that you see about FEMA.
Excellent, thank you very much. So next up is Julie Tertange, who is the One Health and Integrated Climate and Weather Extremes Research Lead for NOAA's Climate Project Office. And so I'm very pleased to have my colleague from NOAA here to speak with us.
Thank you. I actually also, in a very genuine way, am quite happy to be here. Thank you for having me. I imagine that most of you have heard of NOAA and some part of NOAA before, and despite the fact that I have a really long title, fundamentally my job at NOAA is to be the intersection between NOAA's capacities and the health community writ large. I'm in the climate program office. I've run an oceans and health program. I've been sort of across the agency. And so we at NOAA, as you'll see by the end of this, have a lot of capacity that serves the health community, but again, the one word that has been consistent is authorized. We are not actually an authorized health agency. So what I get all the time is, oh, we don't do health. Oh, but we do forecasting that protects lives. We do forecasting that tells you whether the seafood is safe to eat, but we don't do health. Okay, so just so to be clear, we don't do health, but we do health all over the place. So, all right, where's my, okay. So I thought, starting not defining exactly what a disaster, we heard a little bit of that this morning, but in particular, we are seeing more of these things as climate changes, as our societies change, as our cities evolve differently, as our building materials change. I'm going to learn more about that as we go on. So I wanted to sort of raise the fact here, in particular, even heat waves. Heat waves are not officially considered a disaster by FEMA, but if you look at what happened in Paris or Russia, they can be a disaster. And even if you don't consider them a direct disaster, it affects the disaster response and recovery. So I think we need to be thinking holistically about the environmental impacts of our the context in which we're operating. And similarly, wildfires, we're seeing more and more of those. And what's the direct effect? What's the chemical composition of the wildfire? It's the same questions that were being asked by Dr. Lurie during the oil spill. So what is the particulate matter? What are the chemicals in those, and what we're being exposed to? So we're already really stressed. Now, I did the thing that you're never supposed to do, and I chose to do it anyway. I haven't done it in a long time. This is an org chart, in case you didn't know. And this is not my writ large. I don't have the little thing that you have to say, but I did actually feel like, I felt like a lot of you might know pieces of NOAA, and I really wanted to give you a breadth of what we do. And I'll probably have to go a little quicker through some of the other slides, but basically we are part of the Department of Commerce. We're a sister agency to NIST, and our job is to understand and predict changes in the oceans and climate in the Earth's atmosphere. We're the prediction people. We share knowledge and information with others, which would mean we have to work with health people, even though we don't do health because we're not authorized, and to conserve and manage coastal resources and marine ecosystems. So the boxes that you see along the bottom are our official programs. That NESDIS is our satellite environmental data. So we have a ton of data, as you know. And I'm going to pause here in just a second and say, if you look along the bottom, the research, observations, modeling, prediction, resource management, enforcement, those are all the functions, and they are not exactly aligned with each of the line offices. So NESDIS is our satellite and data folks. NIMS is the National Marine Fisheries Service, the Ocean Service. So many of you probably know the Office of Response and Restoration. For the oil spill response, we were very active in that. That's where a lot of the restoration money for the Gulf Coast restoration work went and is managed. Some of the tools that you might have seen, the environmental response and management tool that sort of tracks where the ocean currents go and uses the USGS data and all that. So it's not like we don't talk. So some of the response tools come out of our ocean service. We also have the Weather Service, which is a part of NOAA, believe it or not, although they often are as NOAA and the Weather Service. They're actually a part of NOAA. Just don't tell them if they're here. It's news. Shh. But they do predictions, right? They're the prediction people, and they do seasonal predictions, and they do yearly predictions. They do longer-term predictions. So you know the Weather Service because they're part of your incident command structure and your response strategy. But we can do a better job of using the information they're already producing to plan better and longer and further ahead, and we can do a better job of helping them produce something more useful. So there's a little back and forth that should happen there that I think we can improve on. OAR is Oceanic and Atmospheric Research, and that's where both of our internal laboratory structure is mostly housed in OAR, and our extramural programs, of which there are several, are in research, the research part of the program. And then OMAO is our ships and vessels of convenience and airplanes, the P3s that fly through the hurricanes, and the vessels that respond to the oil spill, and that do fisheries enforcement. So I probably, I'm going to just spend a little more time on the org chart slide because I'm going to make a story here about the fisheries and the vessels. So during the oil spill, Deepwater Horizon, you know, NOAA's jumping into its incident command structure, and we've got people doing marine mammal work, we've got people doing oil spill response. And back to Nikki Lurie's questions. So is the seafood safe to eat? What are the dispersants doing to the ocean life, to the seafood? Well, it just so happened that I ran an Oceans and Human Health program and had a small marine sensors program that was developing sensors that were about ready to be tested. We didn't know how to answer that question. And I'm like, well, so NOAA set up this science box. My job was to lead this science box. What is the science questions that will help answer the oil spill so that the next time we have this, we aren't asking the same questions? And we're still asking the same questions. So just to say, we still have a way to go. But we ended up just deploying one of the testing, one of the submersibles that we were testing, and that's how we did it. I mean, we didn't have a plan, we just made a plan. So I think now we should have a plan. Anyway, that's one example. And the other one on the data side is we collect lots of data, and I will reiterate the data question from the data side of things. Again, during Deepwater Horizon, Nikki Lurie, great questions. Great, let's do this data integration. You guys do big data at NOAA. Well, let's put all the data, let's collect all the data. You do data, we'll give you our health data, and you can put it all together. And I was like, in charge of the science box, that sounded like a great plan. Well, that very quickly went way above my pay grade and got lost in somewhere, and I think never happened because it was actually really complicated. So I think the intent and the will is there, and the capacity is there. And at the end, I think one of my challenges to you all will be to deal with some of the institutional challenges as well as the research challenges. So the point of all of the environmental information that we collect with GS and with our other partners as well is to use that to get ahead of whatever curve it is. This is a disease outbreak curve. It's a generalized curve. And the point of this is if you can use all of the tools and sensors, it's like earthquake warning or the tsunami systems, we are doing a much better job of getting out in front of it, of pre-positioning and planning. We're not there yet, but the capacity is there. And if we're able to do that, we can move all of these things forward and really reduce the cost and lives and economic impact as well as human suffering. So there's a whole value of benefits. This is not news to you. What I am trying to say is that we can get much farther out ahead of it than just the research about response. We can do research about how far ahead and what do we do, at what time scale, what forecast products do we need, what data do we need, how do we actually get ahead of this, and how do we set up our institutions to behave differently in a sustained way, not just, wow, Aubrey, what are you doing with that oil spill data, you know? So my point for this is that NOAA has a lot of capacity in climate, weather, fisheries, satellite, regular in situ data, and health is in all of them. We do research, actually. Our Office of Response and Restoration, which is probably many of your entry points for NOAA during the response part, because they generally coordinate even within our own agency, unless you're a marine mammal person, and then it's a whole different thing. Or a turtle, which is a whole different complication with the USGS. But anyway, it is seriously, you know, turtles are managed differently than, yeah, so we've got a lot of coordination that we already do. But my point here is that health is across all of these, and some of the research is done in response and restoration. Some of the research is done in the lab. They don't think of it as health research. Or maybe they could be doing something that is more targeted for health, but since it's not in our official mission statement, they aren't doing it, but certainly we could. So I think the idea of a strategy and a plan, and why I said I'm genuinely quite grateful to be here, is because I think when David called me and said, hey, we'd like for you to be on this panel to talk about disasters in health. Well, I coordinate a health group across NOAA, and I was like, wow, okay. You know, we don't actually have a disasters focus of our working group, but let me go see if I can find some people. And so I did. I talked to the fisheries folks, and I talked to the weather people, and I talked to all the people like, well, you should go because you're the health interface, and we do this and we do that. So I could have had a laundry list of stuff we do that would be supportive, but we actually don't have a really good internal plan. So one of the things I'm hoping to get out of this is a better plan, even within my own agency, because there was a real willingness. And actually, I did go forward, and people are looking for me to come back and say, great, you know, there was a meeting that Aubrey led a couple weeks ago, and this one. And so it's forcing us to work together a little bit differently inside our own agency. I found this slide, which I thought was perfect, even for within NOAA. It's George Bernard Shaw, the illusion about communication is that it has happened. I mean, the problem is that it's happened. And I think that's true internally, and I think it's also true as we try to bridge these gaps, even within, you know, our own federal system. With academia, we use different language. We don't want to get lost in definitions or whatever. We want to be able to move forward. So I guess I want to leave you with 3 points. One is that NOAA is more than data. We're more than just oil spill response. We're research partners. We are data integration partners, or we should be. And I think there were some questions that came in from the participants, and several of them addressed the data from the health side. What health data should we be collecting? I would just posit that we need to be also equally clear about what environmental data we should be collecting and to co-locate them. That is actually a challenge. We can collect, we've got all kinds of data, you know, we got minute by minute data in some of this, but is it in the right place where the health data are being collected, or where you need the information, or where the output should go? That I'm not so sure about. So data, research, and then I would actually make a plea almost, or a challenge to us as we move forward together to figure out some of those institutional constraints, not just US government constraints, but how do we actually act early? What are the incentives for state and local communities to get way ahead of this? Not just planning for the next disaster, but planning in long term, building the resilience that we heard from FEMA. So I think we're all talking about longer term resilience here, and I think there are some institutional challenges that we have to face. There are research questions about them too. So it's not just an institutional policy fix. There's a research questions about it. Who's doing what and why, and what's the best and optimal setup. So with that, I will thank you again for inviting me, and I'm looking forward to the rest of the day and a half. Thanks.
All right. Well, not only did my colleagues provide a great set of perspectives, but they also did so leaving time for discussion and your questions. So thank you all. That was great. So please, we do have the two mics here, and invite your questions as well as your thoughts in terms of the aspects of the Federal Disaster Research Enterprise. So please.
Hi, my question is for Dr. Kolf. What data sets are you using to determine population health data? You talked about de-identified data, and I'm wondering, is it not working? And I'm wondering what data sets you're using.
So it's the HCUP Healthcare Cost and Utilization Project data within the Agency for Healthcare Research and Quality. So it's the administrative patient records from hospitals.
Okay, so my next question would be, and I probably should just talk to you offline. Matter of fact, I'll just wait. I don't want to take everyone's time. I'll come see you later.
Okay.
Hi, my name is Amit Mistry. I also work at the NIH at the Fogarty International Center. We've talked a lot about sort of silos in government. I know that's an issue in academia as well. I'm curious if the field of disaster science and disaster health, do you feel that it's its own discipline, or do you feel that it should be something that's integrated throughout all the other disciplines that it's relevant to? And I think the same second part to my question is around funding opportunities for research. Do you feel like disaster research should have its own sort of set of funding opportunities that are specific, or would you like to see more disaster-related research funded through sort of the NIH mental health calls or the environmental health calls and that sort of thing? So appreciate, maybe Aubrey, you could start, but whoever else would have some thoughts.
I think the perfect people to answer this are Lori, Tom, and Tricia, who have been having these conversations for a long time and are much better than us at answering that.
But I guess I'll go to your first point, Amit. I think part of our challenges is, right, we have these investments in science, especially from NIH, right? We invest across the country and I have this world of great scientists, but there's no way for them to play, right? How do we allow them to participate, whether it's environmental research, mental health research, et cetera, without turning them into an emergency responder, which they're not going to do, but we have to figure out a way to allow them to contribute either their experience, their wisdom, their technology, et cetera, in ways that are functional, supportive and helpful. So it's not just a bunch of us sitting around going, hey, what do you got on MCHM or on the oil spill stuff going, well, we got some scientists internally, CDC's got a few. That's not the answer. The answer is bringing our investment publicly, our world of investment to the table in a way that works and creating that system. And with that is some funding that hasn't been here to do that. So nobody owns this space. So when it happens, we're going, okay, how do we interact with each other functionally to create some kind of network that's working, yet nobody owns it. There's no one's going to, FEMA doesn't bring the science and our partners together. Nobody does that. So we try to do it on the backside. And there needs to be some funding for that, but there also needs to be funding for the science, for research too. So instead of us scrapping together ad hoc every single time, trying to do this in a much more strategic way to answer those critical questions that Tom and others talked about. We know the questions pretty much that we will see much of the time. What are the community health impacts and vulnerable populations? What do we know about kids? What do we know about these exposures? What do we know about the medical and therapeutic outcomes? A lot of it's novel, might be novel therapeutics. It might be therapeutics that we never tested in certain populations. So we need to be able to capture that. We can anticipate a lot of these questions all the time, but yet we don't get it, which is amazing to me. I mean, I know, I mentioned mold before, but mold comes up all the time. It's like, we still don't have a good science base. We spend billions of dollars cleaning it up, but we don't know who's really going to be at risk and what we're really going to do with respect to it. So in that space, I'd also like to comment, but I'll come back to it, about the Gulf spill, since we had a lot of talks about it, but I want to make sure my colleagues have time.
So I'll answer this question using my hat as a former academic not too many years ago, and say I do think that there is a space for disaster science as a profession. And Scott Miles, who's sitting in the audience, actually had a session at the last maybe National Earthquake Engineering Conference that was around this, or maybe it was at the Natural Hazards Workshop, sorry, in Lori's workshop, that asked this exact question, and it was amazing to see the passion in the audience on both sides. And, you know, I would say from an engineering perspective, which is where I come from, it's very funny because engineers define themselves by the hazard, right? You're either an earthquake engineer or you're a wind engineer, you're a flood engineer, and they don't think about disasters in general and what that means kind of more generally to communities. So there's something that they're missing, and I so would love to have engineers kind of get that. But then on the sociological side or the epidemiological side, it's so much the methodologies that are driving this, right? Are you a qualitative sociologist or a quantitative sociologist? Or, you know, so I think having some space where we cross that, and we do so every summer at the Natural Hazards Workshop, and that's so lovely, or we do so at Aubrey's meetings, which is so lovely, but I think from a curriculum building perspective, I'd love to see some of this happening.
Hi, David Abramson from the New York University College of Global Public Health. Thank you very much. It's a terrific panel. And the question is essentially for all of you. We as researchers often, I mean, you talked about when you have questions after a disaster occurs. And Laramie, you really laid out, you know, a whole host of questions. But when a disaster occurs, we in the research community have our own questions that we think would be very interesting, unique, innovative, that would not only respond to the immediate disaster, but hopefully respond to future disasters as well. How do we engage you in that moment? You're often very distracted. You're dealing with the disaster. We'd like to call you. We'd like to figure out what is the mechanism that we could reach out to you to find out what do you need? Here's what we're thinking about. What kind of data do you have? What are the partnerships that we could engage? We may not be in that disaster geography, but we can help people that are researchers there. I know that there are a lot of nascent things that are trying to occur, and I'm just wondering, what would you all recommend to us in the research community how to reach you when we have a good idea immediately after an event?
Sure. Yeah. So I'll start, and I would say the best way to reach us, NIST, is to actually call us, really call us. So we score, at least in our program, we score every major event in the US, and we're trying to assess, based on the information coming in, on what kind of response we're going to have. Whether or not we're gonna send an initial team and do a preliminary deployment, whether it could turn into an NCSC investigation, and you know, being able to collect some of those observations will help us decide that. But in every single deployment that we've had, and we've had more than I think a dozen since I've been the director of the program, we have collaborated with academics the entire time, right? Asking questions, what are you collecting, what are you doing, putting them in touch with our researchers that are in the field. David Eisenman called me after the California fires. I put him in touch with our team leads. And so I feel like I do what I do well, which is just connect. You know, I know what's going on at NIST pretty well in terms of disaster science, and I know what's going on in the academic side too, but if you reach out, I promise that you will get connected.
So your question goes to an issue of, wouldn't it be cool if there was a group that you could connect that was actually talking to each other and connect? It's like, oh, if NIST is looking at this, we could look at this and be able to do that. We're working with the national academies now with another forum for this type of interaction, which will be useful. Our DR2 program at NIH has, you know, we get calls all the time about, well, do you have any tools or anything like this? And we'll kick them out to researchers right away and say, here's a protocol, here's science tools, here's some of the epi tools that people have used, you know, anything that we can find. Working with the National Library of Medicine is great, because that's what they do for a living, and they can figure out where stuff is and information to the extent that they have it, both in the published literature and in the gray literature. And so we work to, you know, endeavor to try to get people information on tools and resources. Going a little more to your point, in a sense of, I'll just try to make a comment about not only the academic concerns, but the community concerns. Right? I mean, how do we filter that in? And I think NIH did a really interesting model, and I wanted to go back to the Gulf for just a second. When the Gulf oil spill hit, there was kind of two things. There was one, okay, we're going to do intramural epidemiology study of workers, and you know, it turned out to be 32,000, which is still ongoing. So not the short-term, but also the long-term tail of workers. But there's all these questions that Nikki Laurie and others that we've been sitting around going, well, we don't know, and how do we address this across the Gulf? And so it was interesting. So the NIH pulled its money from 9 institutes and created 4 centers, academic centers across the Gulf. David, you were part of this, across the Gulf, to look at issues that were both academic and community concerns across the Gulf, in partnership with those communities to explore and then fund that research. And I think that's a really cool model of intramural connected to extramural, connected to communities, connected to academic, and the way things could work. I mean, one thing that was kind of missing that would have been great was also we're having these meetings go, what did NOAA find? And what's EPA got? And like, what do we understand about these exposures? Because had we actually talked earlier, you know, and had this earlier, we would have gone, hey, EPA, here's where we're going to be looking at human health populations. It'd be really nice if you got some data that was actually in those geolocations. Things just, even simple things like that, having a conversation earlier about what are we going to look at, what are some of the issues together as these agencies are sitting here, would change the ability to get good information to answer questions instead of after the fact spending millions of dollars trying to figure out what your data looks like and anybody else's.
Okay, so I have 2 answers to that. One is the more immediate answer, and that is, much as Judy said, I think where your funding is and where you think you would best fit, just reach out to them, email or phone, because during a response is not the best time to do it. So I think there are possibilities. I know NSF has a rapid program designed to get academics out in the field, and most of us have some way of deploying a piece of that, right? Or a person, you've got contracts someplace, or you have a cooperative institute, or you've got people you're already funding, and you can sort of retorque some of that. So that's the immediate thing, which I'm sure you've already been doing for many years. The probably longer term answer is a more structured program or set of protocols to which we all adhere or agree or begin to do more regularly. So during a response is really not the time, right? You want to have it set ahead of time, and I think that's part of what we're doing here. So I would second to the longer term strategy of how to help that engagement.
This is a really challenging question from a response organization perspective, especially for me being, I guess, a recovering scientist is what I might be called these days. Because I love the interesting research studies, but if it is not going to be directly improving patient health and outcomes, or is in any way going to be interfering with the responders and taking their time away from the patient health and outcomes, that's a really hard balance to strike. That a lot of academics want to be involved, they want to deploy, they want to go and do their studies. But if it's not having a direct impact on patient outcomes, or it is taking the time away from responders or adding extra stress to people who are affected by the disaster, that's something we just can't support in the middle of a response. Not that I'm a real doctor and have the Hippocratic Oath and all that, but first do no harm definitely applies in this case. And so it kind of tears at my heart to not be able to say, ooh, this is a really interesting academic study. So I guess my advice would be, take all of those great questions that you have, and for the immediate response, pare it down to the ones that have a direct, immediate impact on improving patient lives and improving our operations, and those are the ones that we can work with you on.
Yeah, and I think similarly from FEMA, preparedness is not necessarily just about preparing for your response to a disaster, but it's preparing for how can you as an expert be of assistance during that. And so, setting up that network beforehand so that, to be honest, like the 2017 hurricane season, there were like tumbleweeds blowing down the hallways of FEMA. Just nobody's there, right? So, but 6 months later, we're all kind of sitting around thinking like, oh, well, who was paying attention to these things? Because all I was doing was something else. So it's really, that's the time to set things up so that they can be in place so that you can execute during.
But there is a recovery framework. We just got to figure
Right.
out how to get into that space.
Yeah, Russell Andrews with the World Federation of Neurosurgical Societies. It's great to see the national, the various institutes and what they're doing for this field. A couple of thoughts. It came up earlier about getting the public involved in disaster response, and I might suggest, some of you may be familiar with the Think First Foundation. They go into school systems and show kids how to not do stupid behavior that causes injuries. Well, the Brazilians have gone a step further. They've actually integrated into the school curriculum. And I would, is there programs going on to actually get into, say, elementary schools? Because kids take things home. If you want to change behavior in the community, I think you start with the kids who are, under age 10, because they absorb all this and, wise behavior and what to do in emergencies. I wonder if there's any programs to attack it from that level. Second thought I had, is there any involvement with these organizations? In a few weeks, there's the World Health Organization has the World Health Assembly, and just prior to that, there's Global Program and Disaster Risk Reduction. You're probably, is that something that's shared information between other countries and what you're doing?
I think specific to the youth, we actually have an entire youth focus within our division. And they've done some really exciting things. I had mentioned the Until Help Arrives program, which is, it actually came out of the Boston Marathon bombing, looking at what could bystanders, which is kind of a bad term, but that's what it is, what could they have done to help other individuals. And really, the number one thing that we found that was a barrier to people helping was they were afraid of being sued. This is America, and that's what they were afraid of. So we created this training program for people to do very simple things to help people until the help arrives. And then just last summer, we released a new program that's similar to that, but it's for children ages 5 to 8, and it's called Ready to Help. And it's a physical card game where people get challenged on different things, like, your friend's grandpa doesn't look so right and he just fell over, so what should you do? And it teaches them very simple things like call 911, stay calm, give comfort. And so, yeah, we're definitely looking at how we can teach youth very simple things, because to your point, that normally starts a conversation around the dinner table, and then it engages the entire family.
Yeah.
Stay out of that door frame.
That's right. The door is just going to hit you. No,
there
and
any-
along those lines, I mean, a really, wonderful partnership that we've had, with FEMA and with the states has been around that notion of the Great Shakeout, where we've got now, I think it was over 61 million people participating in that. And it's not just that participation in the drop, cover, and hold on drills in the schools, but trying to have that happen also in in places of work, so that you can get to that dinner table conversation, because that's what then motivates. It's not what government tells you, right? It's what you normalize, and that's what we've learned from the social scientists. Thank you.
Thanks.
John Balbus with NIEHS. Comment and a question. One of the areas where I think there's a very big gap in both the response and in the research side are in the mental health consequences. So the question I have is, for the things, we've kind of touched on it a little bit. The last question actually touched on it, because preparing children is a way to inoculate and to help in the preparedness phase to lessen the impacts. But what else are we doing and can we be doing in a proactive fashion? I mean, there's a huge response, and needing to mobilize psychological providers in a response. But like Laramie, will you have the psychiatric hospital admissions in that amazing database that I'm salivating about? How do we incorporate behavioral and mental health into all of this work, in addition to looking at mold and injuries, et cetera?
So our data are based on ICD-9 and ICD-10 codes, so yes and no. Yeah. As anyone who's ever worked with them knows, they're very, very complicated. Mental health, in the analyses that we've done on previous hurricanes, there are these weird rhythmic spikes in mental health hospital admissions. There is a spike in the first week or two after a disaster that is largely substance abuse issues, people relapsing, either not being able to find their usual provider and then having some mental health consequences from it, or getting a new provider and overdosing and coming in with that. A lot of people not having access to their normal medications, so you're seeing underlying behavioral health effects from not being medicated. Those show up a little bit later. And then you see a big spike at 2 to 3 months out and a big spike at 6 months out. And so it's different things in different ways that different people are dealing with it at different times. And so starting to understand what are some of the patterns, what can we know what to expect in the future, and help the health system prepare for that is a really something that I'm trying to move into. It's so hard to quantify behavioral health and know how particularly to deal with it because it's so individual. A broken arm is a broken arm is a broken arm. There's been, I guess, for me personally, one of the responses last year was really, really hard on me. It was my first time leading a response. As Mr. Fugate said, you don't forget your first one. It kind of destroyed me, and I spent way too much time crying and not sleeping and not eating and overeating. And Dan Wall, Ventura County EMS, organized a meeting this past summer that was for Ventura County, which had the borderline shooting and 2 major wildfires in the last year. Their keynote speaker was Dr. Judy Ho, who has her own show on CBS, is a clinical psychologist. And she took this group of 600 people at this meeting through how do you identify the responder community, how do you identify what your personality type is, and then went through coping mechanisms that are tailored to each personality type. Helping people understand, yes, there's a stigma around mental health. It's especially bad in the responder community, but we're the ones who potentially need it most. How do we help ourselves individually, that a broken arm is not a broken arm is not a broken arm in this area, and how do we find ways to make ourselves healthy and then help other people in the same ways, that it becomes sometimes an aside, but an aside that we can focus on and help in the middle of a response to give people the tools they need in the whole of a person treatment.
That's the last question.
Comment
Oh,
after you're
sorry.
done.
Just real quickly. So in a sense, John, actually mental health is one of probably the better studied areas of disaster research in a sense, because I even look at the metrics in our DR2 site that of surveys and tools available, a lot of it has to do with mental health and the socio-behavioral sciences, the Lori Peaks groups that work on a lot of that piece, and NSF also funds in that space. But areas are missing. Clearly, there's chunks of areas, whether it's certain vulnerable populations, children, et cetera, and also longitudinal research is really hard to do. So what do we really understand about those risk factors for resiliency at both an individual level and a community level? And there's a lot that needs to be done in that space to see what is it that helps put people at risk or helps them to be further fortified from those types of things. Like Laramita said, there's movement in the space of psychological first aid and training and things along that line for some of the work groups that we try to contribute to. But again, that should be informed by good data, good science.
I'll be brief, but you probably wouldn't expect Nova to respond to a mental health question, and I wasn't going to. But I am, because I'm glad you raised the responder. We have had people from our marine animal health program on the ground for 6 months during the oil spill response. That has a huge impact. So I would just reiterate, there's a community impact and there's a responder impact, and I think we have to reduce the stigma about the responder impact because it's not trivial. I mean, you're down there living it every day. You're watching the dead animals die. You just can't, it's hard. It's really hard. So that's thing one. And thing two is we actually, on a community level, we have some programs that help sort of build resilience in communities, and one of them is Sea Grant. And we do a lot of work with the fishing communities for oil spills, and I think that's the one that we most do. There are other mental health issues, but we actually have a specific mental health piece of that entire portfolio for communities that are affected by disasters from hurricanes and fisheries. So it's not great. I mean, it's there, but we could improve it.
Right.
Yeah.
Hi, I'm Grace Doherty. I'm a geographer. I'm working with the GW School of Public Health as well as the World Bank. There's a lot of acronyms, but I won't delve into those. So I was just curious because, going back to the question of cross-disciplinary disaster science, I wanted to hear from you on what you think that that side, the geographer and geospatial data side of disaster science should be doing to connect more with the health side. For example, whether it's the OpenStreetMap community or the way that data is collected through participatory and community mapping. Just wanted to hear more of your thoughts on that process, or whether health should be doing more to connect with that community.
Do you want to go or you want to?
So it's nice that we're here at AGU, and they've created a new GeoHealth section actually to kind of think about bringing together, the different disciplines in a way that's more helpful to solve problems, not specifically focused on disasters, but in general for the geoscience and human health communities, which is great. In terms of this, there's so much opportunity. There's all these, citizen science and community engaged partnerships and ways to express both the transdisciplinary science, which is obviously about environmental health. You can't do unless you're doing it transdisciplinary, but thinking about what kinds of ways can we use those forums and those ongoing activities, like Thriving Earth Exchange is one of the AGU activities, ways to use this as a way to leverage our response to what we do in relation to emergencies and disasters. And we've been trying to work with that with our grantees and our centers in ways to think this through. That was some of our scenarios of how do we accelerate it and then bring them to the table. That is functional and useful, that also involves the public health community in ways that they can engage. It was interesting when we worked with health departments, we go, look, when something like this happens, we're going to do our emergency health stuff. We don't have the bandwidth to do data collection. But the university does, or other groups do, or work with GS or other groups in a way that we can tweak out and answer those priority questions together as a community and use community situations to just further that and then apply it for situations when something happens. And we've seen the actual models of it. You guys.
Just real quick, I want to say that I can't imagine doing our science without you or folks like you. I think you're instrumental to everything that we do, and even just for our Hurricane Maria investigation, we've hired not one but 2 geographers because it's so essential.
So much of the information, the way that science gets into, say, an EOC environment or any of these, it's through a map.
And I second that with the GIS tools. We have some at NOAA, and I think one of the next steps for this community is probably to make sure that, it might be an experimental thing. Like, let's take the IRMA project, which is probably the most robust thing that NOAA has, and let's try to add some health data to it and see how it works, right? Let's see what actually happens. That will then tell us where we need to improve our environmental observations or whether we need to do a better job on the health side or where that intersection is. But I'm not sure, if there's an answer, I'm not sure I know what that is. I think that's actually a really good question. Yeah.
So just one cool example of it, again, going back to Hurricane Harvey, is the public health departments in Houston stood up and they basically said, look, we can't cover all these areas. We're going to start GIS mapping it, and we're going to talk to others about where you can go and help us get data and information. So they were working with the academic community and others, and they were kind of like centralized, and they were working with GIS mapping to try to understand those areas environmentally and some of the risks, schools and different areas. So I think that was really cool, and that was an interesting example. And maybe Umar and others will have additional comments later.
So on that collaborative note, I am going to need to cut it off, but please come up, have a chance to chat with our panel afterwards. I'll turn it over to Tom, but maybe a final round of appreciation for this panel.
So I have to welcome you again to Fedland. We're not allowed to buy you food. And I think all the federal people here know that. So we have sandwiches and salads outside and some fruit and stuff, but we have to ask you to provide a donation, and I assume we're going to have something out there. If you're not interested in eating our sandwiches and salads, there's places around here, but I would recommend you stay around because at 12:45, Dr. Lori Peek from the Natural Hazards Center is going to be giving a talk about some activities, and I think mentioning the Alliance, I guess. So please, we have an hour and a half for lunch. The purpose of that is threefold. 1 is to gain sustenance. 2 is to network and to ask questions both amongst yourself as well as with the different panelists. And 3, to listen to another talk. Thank you.
Thanks, David. David kept us pretty much trained by it. He was good.
Oh, yeah.
He would just go like this.
It is running hundreds of seconds. I was trying to get to the question.
He was like a soup Nazi. Move along.
I'm like, I know Aubrey has created, was Compute created that intergovernmental coordinating.
I just love all around.
Okay. That we want to hear some academics, we want to hear. I think every reason we did, we had some kind of partner in the field that was. Who'd you write it with?
Yeah.
And, but I think it didn't matter. Having a relationship ahead of time.